It's me Javeen and welcome to my YouTube channel. Today we are going to discuss the anatomy of a scapula. The learning objectives of the anatomy of the scapula are: first of all, I will introduce you about the scapula bone. Secondly, I will discuss about the three borders, two surfaces, three angles, and three processes of the scapula. And at the end, we will discuss about some articulations of the scapula. So let's come to discuss them first, one by one. First of all, the scapula is a flat bone which is present on the posterior lateral side of our body and placed on the rib cage. Secondly, the two surfaces of the scapula bone are: one is the posterior surface, which is a convex shape, and the other one is anterior surface, which is concave in shape. Then the three borders of the scapula: one is the lateral border, which faces our lateral side. One is the medial border, which faces our medial line. The medial border is also called vertebral border as it's facing the vertebral column. The one is the superior border, which faces our clavicle or which is on the superior part of our body. This is called superior border. Thirdly, three angles of the scapula. One is the inferior angle, which is formed by the joining of medial border and the lateral border. Second is the lateral angle, and the lateral angle is formed by the joining of medial border and the superior border. And one is the superior angle, which is formed by joining the medial border and the superior border. There is three processes, and then one is the spine process, which is present on the posterior lateral side of the body. At the end of the spine, there is an acromion process present. It is also present on the posterior side. And one is the coracoid process, which is present on the anterior side of the scapula. The coracoid process is like a bent finger shape. At last, we will discuss about some articulations of the scapula. There is a intraspinous fossa and a supraspinous fossa. The spine, which is present on the posterior side of the scapula, divides the posterior side of scapula into two parts, into two fossas. Fossa is like a cavity, is like a rough surface on which the muscles have to attach. The spine divides the scapula into infraspinous and supraspinous fossa. On the supraspinous fossa, supraspinatus muscles are attached, and on the infraspinous fossa, infraspinatus muscles are attached. And on the anterior side of this scapula, an anterior fossa is present, which is called subscapular fossa. And the muscles attached on the subscapular fossa are called subscapularis muscles. And beside the coracoid process, there is an indentation which is called suprascapular notch. And on the acromion, there is a facet is also present, which attaches the scapula with the clavicle bone. And lateral angle of the scapula, there is a glenoid cavity is also present. The glenoid cavity attaches the scapula with the humerus. So it's all about the anatomy of the scapula. If I give a comprehensive overview of this topic, so scapula is a flat bone which is present on the posterior lateral side and placed on the rib cage. The scapula has two surfaces: posterior convex surface and anterior concave surface. And then scapula has three borders: medial border, lateral border, and superior border. And then scapula has three angles: medial angle, superior angle, and inferior angle. And scapula has three processes: spine process, arachnoid process, and coracoid process. And there are some articulations. One is the supraspinous fossa, infraspinous fossa, subscapularis fossa, and then subscapularis notch, facet, and rhinoid cavity. And it's all about the anatomy of the scapula. I hope that you like this video, and if this video is helpful for you, so much like, share, and subscribe. See you in the next video. Bye bye.